and you should all get a notice on the screen. Thank you, Kelly. Very much appreciated. So really excited to hear from NHS Grampian today about their anti-racism journey, and really, really grateful for Liz and Sneh to give up their valuable time to talk to us today. Members of this community have asked a number of times that they really, really want to ask not just about the theory of anti-racism, but about the practice. What does good and emerging anti-racism practice look like? So we are absolutely delighted to welcome you, Liz and Sneh. And rather than me reading out some really boring bios, or me being boring, reading out the interesting bios, actually, I should say, I'm going to ask Liz and Sneh to introduce themselves and to cover three main questions. Who are you? What do you love? And why do you care about anti-racism? And then we'll kick off the presentation. So over to Liz and Sneh.
I'll let Sneh pick that one up first.
Good morning, all. Sneh Banik. I'm a consultant physician working in Aberdeen Royal Infirmary. I also work with the students and junior doctors. I'm a senior lecturer of the University of Aberdeen and also a program director for Specialized Foundation Program for North of Scotland. So that's quite a few areas I contribute. I'm the Equality, Diversity, Inclusivity Champion for NHS Grampian and University of Aberdeen, working in this role for the last 3 years. So great to see a great turnover today, and looking forward to the presentation. What do I love? Well, I title myself as a creative entertainer, so I really love to entertain people. I like to make my patients like feeling very good after I have done my clinical encounter. So happens with the trainees and the students. I like to make them feel good. And that takes to the third question: why do you care about anti-racism? My values were getting conflicted with the racism thing, like when I like the colleagues to be like enjoying the work and feeling engaged in workplace. The corridor talks are not pleasant enough, like people from the BAME group, the colleagues from the BAME group stops me at the corridor, talks about their behavior, unacceptable, painful. So can't really entertain them with the word of hope that has been going on for years and years. Myself, yes, didn't like many of the attitudes around as well. So I think that was a unresolved question within me for a while. So when we got the opportunity to work in this anti-racism journey, it was probably just there for me, waiting at certain points. So that's how I engaged myself, and that's why my commitment is for anti-racism. Off to Liz.
So thank you, Sneh. So yeah, I'm Liz. I'm Deputy Head of Engagement at NHS Grampian, and I am also have a role around being Engagement and Inclusion Manager. So it means that I straddle two areas which actually really complement each other: patient, public and staff engagement, and also around the inclusion agenda. So that's so I think it's a really dynamic space to be working in. So I feel really lucky to do that. Why do I care about anti-racism? Okay, this is something that's been with me for many, many, many years, and I think that it gave birth to me when I was in my 20s. I went off to be a holiday rep and worked overseas in lots of different countries, and everywhere I went, I was always blown away by the hospitality that I was shown by people, including me in their celebrations and their events. And when I came back to Aberdeen, I kind of felt like I owed everybody that had been kind to me that same kindness. And if anyone was ever going to come to Aberdeen from another country, then I felt it was my responsibility to make sure that people felt that they'd had a good welcome and a sense of belonging. And that was many, many years ago. And I've kind of just held that with me, and it's just been part of my work ever since. So it's just a human thing, isn't it? Really, it's just a human thing. So that's why I'm passionate about anti-racism, and it's brought me to this space here today. So that's just such a exciting thing for Sneh and me. We can't believe every day, we can't believe that we're so lucky to be doing this work. It's fantastic. So I could just share my slides. Shall I do that? Remind me to put the volume on, because this is the thing to allow volume. So there's the volume. So can everybody see that, hopefully? So I can see Sneh. Give me a thumbs up if you can see it. Brilliant. Okay.
I can see, yeah.
Brilliant. So, and I think that Sneh and I would both say that just because we're here today in this space with this, we've done this work, it definitely doesn't make us the experts. The situation arose where we had to take action, so we did. And I think that'll become evident as we go through the presentation. But I just think a really good way to start the presentation today would be with a video from our now Chief Executive, Adam Caldwells, who was Deputy Chief Executive when we started this work, but he's now taken on a role as Interim Chief Executive. So it's even more brilliant that he's got this leadership role in our organisation and championing this agenda. So I'll just play this now.
Hi.
While the video is loading, I'm just going to pop in there
Oh,
and
here we
say,
go.
Today we have
Great.
a really important announcement to make. I'm delighted to be able to confirm NHS Grampian is now the first of Scotland's regional health boards to become an actively anti-racist organisation. In addition, we're also launching a year-long awareness raising and training campaign designed to turn that commitment into real and tangible change. But what does being anti-racist mean exactly? We've had a strict zero tolerance policy against racism for years, and we're sticking to that. But today's move is an even bigger and necessary step forward. Being actively anti-racist means more than just saying we won't tolerate it. It's about actively challenging racism and discrimination wherever we come across it. It's about acknowledging our own biases and working to overcome them. You see, over the last few years, we've learned a lot more about just how much damage racism can cause. Setting aside, just for a moment, the very real moral and ethical issues, racism affects mental and physical health of our colleagues. Racism leads to more stress, more anxiety and depression. It makes it hard for people to focus on their jobs and provide the top-notch care to patients that they normally do. So, what are we going to do? For a start, we're going to be making sure colleagues can access additional training in unconscious bias and also in active bystandership. That means we all will have the skills to step in where we witness racism or discrimination. We all also need to be ready for tough conversations about race and racism when we stand up for our colleagues. And we need to be willing to listen and learn from others' experiences. Now, believe me, I get it. Talking about racism openly can be intimidating. When Sneh first contacted me through his work with our Staff Equality Network and also our GEMS group, I was nervous. I'm a white, middle-aged guy. I didn't want to put my foot in it, to say the wrong thing. I wanted to be supportive. But I've learned loads, and it's been eye-opening. It's clearer than ever to me that discussing race and culture in a friendly, a curious way can actually bring people much closer together. And I've also learned, and this is really important, racism isn't just an issue for ethnic minorities to tackle. It's on all of us, especially those of us in privileged positions. We need to step up, call out racism when we see it, and support our colleagues who experience it. The onus is on us, all of us, to be allies for our colleagues rather than passive. This plan, now in effect for NHS Grampian, calls on each of us to be anti-racist. That means you personally, figuring out where in your service, in your team, and even within yourselves, we can make a positive change. It isn't a job for a single team or a department. It's a commitment we all must make. Now, we're not saying NHS Grampian is a hotbed of racism, but every organisation has these challenges. And we're here to do the right thing for our colleagues by facing those difficulties absolutely head on. I know some people will be worrying away and thinking we're going to be labelled as woke or overly politically correct. But let's be clear, this is about treating our colleagues with respect and with kindness, and all of us standing up for them. We all must stand shoulder to shoulder with our colleagues. It's a big ask, but I truly believe we can and we must do it. We have an incredible team here in NHS Grampian, and with a little effort from each of us, we can become an anti-racism organisation. To close, I'm asking all of you to be part of this work, as together, I know we can create a more just, a more equal, and a more effective NHS Grampian for absolutely everyone.
So that was our anti-racism video statement, which every time I watch, I'm just get so proud of watching. I always want to do a little round of applause for Adam at the end of it. I just think it's such a powerful video. So that was just really released recently at our anti-racism festival, which I'll tell you a little bit about in a minute. But how did we get there? Why did we do this video? Why have we gone to all this trouble? Well, you know, an NHS Grampian and during the Black Lives Matter movement in 2020 during lockdown, NHS Grampian received an open letter from the Black Medical Society at the University of Aberdeen, and this is kind of like our origin story, and probably a really good point to hand over to Snee to talk us through this bit.
Thanks, Liz. So yes, 2020, this letter was submitted by University of Aberdeen Black Medical Society students, and really grateful for them, like when colleagues having decades of experience never thought of thought of coming to executive team with their concerns. The students were brave enough to submit a letter to this like this to media and to the university. So obviously a strong letter with lots of lived experience the students were having, both in the educational environment and also in their placement in hospitals and GP surgery. So to start with, it created a huge shockwave within the university. They did a lots of investigations and found that a lot of the stories were actually when these students were placed in their clinical environment from patients and colleagues. So NHS Grampian was then involved, and the higher executive team was really shocked knowing all these stories. At the same time, I was doing some work as well with my foundation doctors to know what is their experience working in NHS Grampian when they have been coming from all over the country, like England, or even from international trainees we have as well. And unsurprisingly, the lived experiences were not matching the statutory reports we submit to Scottish government, which are pretty fair and both in regards to employment, equality, and equal pay. But the lived experience and the microaggressions were quite significant. And I took all these stories to Deputy Chief Executive and the Director of People and Culture. And I think it was a great step at this time, like the higher leadership was involved, and the confession that yes, institutional racism exists within NHS Grampian. So clear confession came from the deputy chief executive, like institutional racism exists, and the chief executive came to media saying that I do not want to lead an organization where institutional racism exists. The head of HR came and showed like there was lack of inclusivity at various staff group, like the board members. There is no representation of the BAME staff. The HR group itself has got very lack of diversity. So these clear confessions came from this as a result of this letter and the engagement we did at very higher level task force and working groups. Next slide, please. So these are some of the task force and working group who started working and investigating the process, our policies. So NHS Grampian and University of Aberdeen started working together with the joint task force, and we in NHS Grampian formed a working group, anti-racism working group. Then from there we started as NHS Grampian Staff Equality Network. So all staff started, we started engagement with staff and started discussing about racism and other protected characteristics. At this stage, I have noticed something like in the Staff Equalities Network, there was very lack of representation from BAME staff. Like it is aimed to staff who are from the BAME staff group, but their representation was pretty poor. I started to do some personal, one-to-one talk with colleagues, and found that there's a significant fear in colleagues, thinking that is it a safe space? Who is going to listen to our stories, and what's going to happen? What actions, what feedback is going to come? So we feel there is another group needed, which would create a safe space, and the deputy chief executive would be there to listen to staff stories. So at this stage, we created our Grampian Empowered Multicultural Staff Group Network. So the James Group, again, thanks to Liz for coming with a brilliant name, James Group, rather than a BAME Staff Group Network. And that was a milestone as well, to listen to people's story and all the ideas and recommendations they have, like what is the representation of staff in the interview panel in higher executive board, is staff from BAME group representing in the disciplinary actions, where General Medical Council says that if somebody is from the BAME staff group, their chance of getting referred to GMC for disciplinary action is 2 to 3-fold higher for whatever reason. So are they represented in the disciplinary action group? And then we found that it's not really an easy thing to talk about race. It's not not easy for the staff who are from BAME staff, because there is significant fear, not knowing what actions would happen, and some of them probably have raised concern, but not satisfactory outcome was received. On the other hand, staff who are on the other spectrum, there is lack of comfort in talking about race, not knowing what language used to needs to used, and a fear of things getting wrong. So to raise awareness, we really feel that it's important to come up with a message like it's okay to talk about race. So NHS Grampian then invested in a video title is okay to talk about race, and then it was made public to raise awareness both in staff and the community. It became our part of the it became a culture change agenda. In that case, we felt that if it just sits in equality and diversity team, it's going to be difficult to work on our agenda. So then we brought culture into it, and that's how the director of people and culture was involved from the very beginning. And we ended up with a clear intention statement that we want to be an anti-racist organization from a zero tolerance organization. That's our responses in a nutshell. And Liz, did you want to show that it's okay to talk about race video?
Yeah, so just while you were talking about that it's okay to talk about race video, I'm just going to show that we have got it here, but it's 20 minutes. So if there's time at the end, if people want to see that, then we can, show a little bit of it. So that's what it looks like. But yeah, just to pick up around the the way that this linked in with culture, I think it's really important. And I think that traditionally, the equality and inclusion agenda has probably been, the remit of equality and diversity team. But I think that we recognised, or we felt it was really important that culture is actually a really important part of that. And this aligned with a significant programme of culture change taking place in the organisation. And I always say, you can't have a culture strategy without inclusion, and you can't have a well-being strategy without anti-racism and anti-discrimination. So for me, they have a very symbiotic relationship, and they're essentially two sides of the same coin. And luckily, our Director of People and Culture, Tom Power, and the wider culture programme, absolutely embrace that. And equality and inclusion is one of the 4 pillars to staff experience that we have in the organisation now. So it's very interlinked. And I also believe the way that culture is so systemic, and our organisation is set up so that the work that comes out of our culture strategy is systemic, because it needs to be. And so by working through that systemic approach, anti-racism has got a better chance to, find its way across the organisation. Just recognising the systemic nature of racism needs a systemic response. So, I really attribute a lot of the success of this work to the recognising that anti-racism, it's an issue that needs to be addressed by everybody. And also just to talk about the way it leads into the organisation as well is our strategic plan for the future. So NHS Grampian's 5-year plan is identified 10 priority aims around people and culture. And you can see the last one there is actually got its own specific aims. So it's really directly linked to the strategic ambitions of the organisation. That's the aim in a little bit more detail. But this was developed maybe a year or 2 years ago now. So right from the start of this plan coming into practice, it's been really embedded in that. So it's really helped get the agenda moving forward. So what was the governance that we had around this from our organisational perspective? This is a very basic kind of diagram. There's a lot more to this, but what I really wanted to do was just kind of try and highlight how the working groups that sat around this, the ones that we spoke about the GEMS, the Staff Equalities Network, and the task force, and our Equality, Diversity and Human Rights Working Group at the time, also sat along this wider programme of culture change. So we've got the Culture Collaborative and the WeCare Staff Wellbeing Programme. And we see these things as being really aligned and feeding into their 2 senior directors in the organisation, the Deputy Chief Executive and Director of People and Culture, which then leads up to the board and then to the plan for the future. So we see these as kind of like pieces of a jigsaw that fit together, and recognising that one can't really exist without the other. So that's how we worked across the organisation, that systemic approach, but also that obviously not the totality of it. I think that the geography in Grampian has made for really positive collaboration with our public sector colleagues, with our third sector colleagues, with our community groups, and doing that work to create safe spaces for people. Also absolutely recognising the great work that had been done before this happened around our zero tolerance approach, and keeping the organisation working the way it needs to in terms of our statutory obligations. So, but just continuing to learn from the research, we're all reading books and sharing ideas and creating safe spaces to come together and have you read this and have you heard this? And so I think there's a lot of energy around and the opportunity to learn and grow together as well. So as I said, this work evolved in 2020 as a result of the open letter. And it was in 2023 that we launched our plan. So that was 3 years of engaging, building relationships, building trust, learning, growing together. There was a lot of longevity behind the work. And the 3 years of conversations that we had really identified these as what our staff felt would be priorities, that if we could work towards achieving these objectives over the 5 years, then this is what would make a lot of impact towards the anti-racism agenda. And we recognise that, you know, this space is fluid and it's dynamic, and we need to be responsive to that. So absolutely, this could change in 3 years' time. Maybe, you know, our objectives will be slightly different than this, but as a starting point and as a place of focus, this is what staff told us they wanted us to focus our attentions on. So this has been all encapsulated in our anti-racism plan. So at the end, if there's time, I can scroll you through it so you can just get a little bit of a visual about how it looks inside. We've tried really hard to make it not look like a corporate typical plan that you might expect. We've wanted to make it look visually appealing and interactive. It's an interactive document on the website. There's links you can click to the It's Okay to Talk About Race video, or some of the other work that we've done that we've got on our website. So it's interactive. And again, as we grow and evolve, we might change the design of it as we get more people involved that are willing to go onto camera and be photographed to be actual people in a plan. But at the moment, the work that went into that was to try and make it look something different and something really positive. So a lot of people ask us what are our objectives that we had identified and for 2023. So I can talk you through some of those. This was our starting point. So and as we look to 2024, we are looking to be a lot more ambitious with our objectives for 2024, looking a lot more at recruitment, career progression. We've already started, as Snee said, a lot of initiatives around things like diverse recruitment panels to start looking at how we disrupt recruitment bias and more diverse recruitment pipelines. So these will be things that we've started to work on this year, but we'll formalise those in our 2024 plan. But these were the objectives that we felt we could focus on this year to get started. So recognising, as Snee said earlier, that a lot of the senior and more senior roles and manager roles, essentially roles where decision making takes place, are not representative of our diverse communities. But we also recognise that that's going to be a long piece of work, and that's, you know, that's a lot of culture change that's going to happen to take us to that place. So what we wanted to do in the meanwhile is create an opportunity to amplify the diverse voices that we do have in the organisation. So we've developed a pilot reverse mentoring programme. We've done this with great collaboration from our Police Scotland colleagues who already had a reverse mentoring programme that they've been piloting. So we've done a lot of learning from them, and can't thank Police Scotland enough for the great support that they've been to us through this. So we're ready to launch our reverse mentoring programme. We'll be working with our GEMS group to be mentors to senior leaders. There's a great appetite from our executive board to have that opportunity to be mentored. So that will be launched in January. We think for 2024, we will adapt this to be a more of a reciprocal mentoring programme. And also just to mention as well that the objectives that we identified for 2023, we recognise, as you know, that while we have focused on race because and racism because of the open letter, the objectives, you know, we will hope to expand these to be available and to make a difference and an impact for people from across all the protected and non-protected characteristics. There's, you know, we're excited to think that reverse mentoring, you know, there's no reason why we can't get somebody from, you know, one of our areas in Aberdeen who's a member of the public to come and reverse mentor a senior leader about what it's like to be a citizen living in a given area of the city and the challenges that they face on a daily basis. So we recognise there's lots of opportunities, and I think it's just about, for us, about developing some initial infrastructure so that we can start to do some things a little bit different. Learning and development is about actually what are we already doing in the organisation around learning and development, and where can we build in some principles of anti-racism so it becomes part of just what we do. Also, myself and Sneh have been super busy having conversations with people around active bystander and unconscious bias. We're busy developing sessions around how to talk about race and allyship. So we've got a bit of an emerging portfolio around that, and we'll do train the trainer so that people can take that training into their own teams and services. So kind of how do we have that systemic approach? There's something about embedding that into induction so that people coming into the organisation know right from the start we're an anti-racist organisation. These are the principles, and this is what we expect. And also it's now available to book on Touras. Sneh and myself deliver that on Touras, and we also have it as part of all our management development training as well. So at the key stages of people's career and through moving through the organisation, they'll be having that learning. This is the Speak Up programme, which I also have to give a thanks to NHS Lothian colleagues too, because they talked us through their model of Speak Up, and it's took us a little while, but we finally caught up to them, and we now have our programme of Speak Up ambassadors that are trained so they can provide a safe space and a first point of contact for anybody wishing to raise a concern. We're absolutely recognising in Grampian that there was a lack of diversity of opportunity for people to raise concerns in a safe space. So this is one of the ways that we've developed in 2023 to be able to address that. That was done alongside the Trickle app, which I think probably other boards have as well, and that's another digital workforce engagement platform that allows people to raise concerns in an anonymous way, and through that the power of digital technology allows that concern to be directed to the person who can respond to that. And these were two of the things that we did, recognising that a one approach doesn't fit all for raising concerns. Also, we committed to a programme of face-to-face engagement, because a lot of the work all of the work that we've done had been done digitally through COVID and developed on Teams. And, as same with all boards, we've got a workforce that, isn't always in a centralised hospital. And in Grampian, we've got lots of rural communities. So we've committed to doing a face-to-face tour of a lot of our more rural communities and having that face-to-face engagement, so people still have the opportunity to get involved and influence the work that we're doing. During 2023, Adam Caldwell's commissioned a succession planning audit of the organisation, and this is part of the work that this will lead into the work that we'll do for 2024 around embedding diversity into our attract, nurture, grow our workforce planning. So this has been, that was a huge piece of work across the system, looking at what all our succession plans are, and we'll use this now to look at how we can embed that into diversifying some of the areas where there's underrepresentation. Our commitment to culture is a resource that has been developed by our colleagues in culture, and this was a co-designed and co-produced resource that embeds a lot of training and access to support and resources that people can use to embed that positive culture in their own teams and in the workplaces. And we have worked with our colleagues to ensure that inclusion is central to that resource. And essentially what it does is it explains to people coming into the organisation what values and behaviours that we expect as an organisation, and that can be used from an introduction into the organisation right through a person's working life. Just to touch on this, we've developed a bespoke equalities data group to look at how we can monitor and set some KPIs around the impact of our work, and that's going to be an ongoing work in progress. Then we've spoken just quickly there about the It's Okay to Talk About Race campaign, including the video. We also have pop-up banners across the hospital site and some badges and lanyards that people could wear as well to identify themselves as a safe space. We also made a commitment to invest in our GEMS group and to work with the GEMS to set themselves targets of the work that they wanted to progress. And as a result of that, we had our Celebrating Diversity Festival on the 4th of October. So I think I could pass over to Snee to talk a little bit about the festival because it was his brainchild.
Thanks, Liz. So the Diversity Festival was in October. October is the Black History Month. It's the Speak Up month as well. So it was the appropriate event to celebrate that month as well. Why a festival? As you have seen that there's a lot of work has been done over 3 years. It has resulted in our 5 years anti-racism plan. This plan sometimes can appear pretty dry with jargons, and is it the right thing to distribute among 18,000 staff? Is it possible to make it absorbed? We felt that culture needs to be brought within the concept as well. So rather than creating the whole agenda as a morning and an inappropriate thing, we felt that celebrating diversity and giving these the whole agenda a festive vibe is the right thing to do. So we thought of bringing people all across the organization, from the top executive managers to the people who work in the shop floor and doesn't even have got access to computers, the domestic groups, the cleaners and sorts of things. So we included various staff group into the festival. We felt that an online platform is not gonna be the right thing. So it was a in-person festival the whole day. People talked about the same agenda, anti-racism, and the like-minded people generated a lot of talks. So it was brilliant to make people understand what anti-racism is, how proactive people can be to make anti-racist organization. So involvement of staff from various groups. We involve Scottish representation from Scottish government, representation from other health boards as well, to know what other good practices are around. There were workshops like active bystander, unconscious bias, psychological safety, how to report racism, concerns of reporting racism, how we can support our huge staff group. So all these things were there, and it was amazing to hear people lived experiences and the hopes that how we can make a huge change in our culture. So that was the program. You can see that a variety of modalities of talks and workshops were there. And there was a Mentimeter as well to know how it's going to affect people's knowledge, skills, and attitudes. And if we see the question, what level of awareness do you have? And you can clearly see that there is a steep rise in the awareness from 3.6 to 4.4. And it just didn't stay on the day. People who attended now is spreading their knowledge and understanding within their own departments as well, which was another aim of us. How knowledgeable are you? Yes, 3.1 at the start, and after the event, again, there was a sharp rise we can notice of 4.1. And how confident and empowered are you? So that was very important to us, like to overcome the fear and feeling empowered in talking about race and raising concern about race and doing something proactively in becoming an anti-racist organization. So that was also one of our success within the festival. This was a word cloud, and words like it was a positive event, engaging event, inspiring event, informative as well. So that was people felt like that, and who attended the festival on the day could see the energy within the venue. So I think it was a successful event. Off to you, Liz. few moments from the festival.
I could never ask for a better platform, than this, to be able to, first of all, listen to the lived experiences of staff, academic, non-academic, doctors, non-doctors within NHS Grampian, their lived experiences of what it's been like on the other end.
From the very beginning, when I walked in the room, there's a real wow, there's a real feeling of everyone being excited to be here, and that's carried on the whole day. Everyone's here because they want to make a difference. They want to make NHS Grampian somewhere where people feel included and welcome.
Making NHS Grampian an anti-discriminatory organisation is everybody's role, start from top to bottom, and I think we realize that we're all a part of it.
We could sense that people are still needing help and support and the knowledge, like what exactly to do, and the enthusiasm needs to come from the very, very top.
It's quite good to see higher management, stepping up and putting their money where their mouth is, essentially, and being actively engaged on this platform. So yeah, that was very good to see.
One really important bit to me is that we've all got to be involved. It's up to all of us. It's not something that managers can do on their own. It's not something that a particular group of executives can do. It's something that everyone needs to be involved in, and that message has come loud and clear.
It's absolutely vital that this work is led by senior leaders. However, it's important to remember that everything in this plan has been informed by our staff, by our workforce. It's been co-produced with people from across NHS Grampian by working in collaboration with our partners in the third sector, our public sector partners, our local authority colleagues. So this has actually been a big piece of work over the last 3 years.
There's still so much to do. Hearing that it is possible to put things in place that start to make things better. And probably the recognition that it's a long journey, and actually it's about us all individually taking small steps towards where we want to be, and we all have the power to make a difference.
This might look like a plan, but actually for me it's an invitation. It's an invitation for all our staff, our teams, our services, our leaders, our wider organisation and partners to think about what it is that they can do in their everyday. So that was our summary from our festival. I'm just realising about our time. So I think just to conclude, I think to summarise, there was longevity built into this. This is why, these are things that obviously help to make the work successful. It being a priority in our strategic plan and being aligned with the wider culture and staff experience programme and the systemic nature of that. The energy and the passion and the can-do attitude of the people involved, and that staff were involved in the development of this work as well and could see their opinions and their views reflected in the document in that when it was released. Can't underestimate the role of leadership and their visibility leading around this work. Sneh and myself were additional capacity that was brought in to develop and lead around the anti-racism agenda. So, it wasn't an add-on to somebody else's work. This was invested in. And also, I think by working collaboratively with the engagement team and the relationships that they have across the system and also externally in local communities and with our partners really helped us to, to piggyback on already great work that was taking place. Some of the challenges that, I think we didn't really have the luxury of fear, although we were afraid, but because the letter had come from the students, we had to respond, we had to do something. So otherwise, I think, we could have sat around and talked about it for, for months and months and months, but we had to react, we had to respond, and we just had to start where we were with what we had, which I think was, just a shared want to do something to make things better. There was, it would have been, I think at that time in 2020, there wasn't the infrastructure in NHS Scotland or around boards to work collaboratively around anti-racism. So there wasn't really a lot of opportunity to connect and access support. Also recognising that anti-racism is culture change. It's hard and there's resistance built in when we're asking people to do things differently. And there was something about a lack of practical resources for boards to be able to use. I just touch on this to say that what was really helpful to us was there was an anti-racism toolkit from NHS England, which was really, really helpful. And what we're going to do next is, we're going to continue to involve staff. This work isn't going to end now. This is a first step in how we work. We need to continue to involve people in that and make sure that the message that we're putting out doesn't just stop on the 4th of October at our festival, and make sure it continues to reach all areas of the organisation. I think that we've still got a lot of work to do around building colleagues to feel empowered to take this agenda forward by themselves, and we want to create practical tools and skills for people to be able to do that. It's about liberating this agenda so that it's everybody's and it's not mine and Snae's. We have to liberate it so that people see it as what they do in their teams and in their organisations. So we still want to collaborate with everybody, and we're delighted to be here today and learn from you guys, recognising we're not the experts by any stretch of the imagination. So especially as we look into 2024, what are the opportunities that we have to work collaboratively around shared items, around ambitions, and just continue to work with others in this space. Probably a bit of a defining moment for Snae and myself was Caroline Lamb was in Grampian on Friday, just past, and she had heard about the work that we'd done in Grampian, and Adam was really keen that she had the opportunity to hear about the work that we'd done. So that was just like a lovely moment that we had last week. And essentially that's our presentation. I think you probably gather we could talk for longer, but I think probably we've talked over our time, and I know that Andrea wanted us to have some time for questions.
And I could listen to you for hours. Liz and Snae, thank you so much. I'm going to ask one question. I'm going to just take the chair kind of facilitator privilege to ask a question. Then I'm going to take a question from Slido before we finish the recording, and then people can turn their cameras back on. So the recording is still on, and we're just going to give people a chance to listen to a couple of questions, and then we'll ask people to then we'll end the recording. So firstly, thank you so much. There was so much in that presentation, and I think a few things that really struck me is, one of them is you don't need to know everything to get started. I think that's really important. We're all learning. We're on a learning journey. I'm learning every day, and there will be lots of colleagues here on this call who are on that learning journey as well, and we'll be so grateful to hear more from about your journey. We've got lots of questions that we have come in on Slido already. So just thought I'll ask if there are colleagues here who are working in organizations, and colleagues recognizing that they want to move towards anti-racism, but the senior leadership buy-in hasn't been achieved yet. Are there any specific words of advice that you could give colleagues in order to get that buy-in?
I think probably Snae would be well equipped to answer this, because I think that the information coming from Snae to senior leaders was really powerful in a way that it wouldn't have been if it was coming from me. So
no, absolutely, Liz. Thank you very much. First of all, as you have mentioned, Andrea, like when we started our journey, I felt that what knowledge I have got other than lived experience, but collectively we probably have got a lot of knowledge around, really. So when we started to engage with the Staff Equality Network and the GEMS group, it was mesmerizing how much thoughts and ideas people have got. So I think the health board should be welcoming in creating these staff equality networks and adhere to their stories, and being brave that unpleasant conversation can happen and take it on board. What can be done about including the higher leadership or getting the buying of the higher leadership? I think a bit of work has already been done. The chief executive, Caroline Lamb, when we met, she felt the appropriateness of creating a new Scottish toolkit of becoming an anti-racist organization, and really welcomed our thought of, creating a Scottish toolkit, which we have already made some conversation with different other health boards, like how we can do it collectively, sorts of things. So this can help in few months or years to come. But at the same time, we all have got a role, like 57 of us are here to spread this message and empower colleagues to be loud and speak up. When we speak up in the corridor, we feel like we are powerless and nothing would happen. But if things are brought to the attention of higher leadership and executives, I doubt that there won't be any interest, or it's very highly unlikely. Whenever I went to the chair or the chief executive or other executive, I was heard, which I never knew that I would be.
Also, if anybody is struggling to, have the message heard, then I know Adam Caldwell's is really keen to come and talk about how important this work is to other boards. So definitely he's a great advocate for why it's important.
Thank you so much, Liz and Sneh. And just an invitation to everybody here to keep your questions coming in on the Slido. I will now take one question on Slido. We'll then stop the recording and then we'll take questions in person. Also, just an invitation that Liz and Sneh and others on this call are looking for opportunities to work collaboratively. And I think the community of practice will be a great point of that. But if anybody has got any experiences, ideas, good practice from your area to share, we would absolutely love to hear about those too. So please do come in with those comments. I'm going to then just take one question from Slido. And so the first question here on the screen. I'm really interested in hearing about what you have done to disrupt recruitment bias. Have you reviewed aspects such as essential criteria, driving license, etc.? Don't worry, if you can't answer the questions, we can always send them to you and you can get back to some of them at a later stage.
So we're looking at so this is something we're just stepping into. So this is something that we've just started to look at. And what this is about is, in the first instance, it's more about our senior roles, where we need to make sure that we, looking how we can essentially diversify. And one of the ways we can do that is by disrupting recruitment bias. So again, this has been led by our HR team with our encouragement, and they are working with our GEMS group. So now what we are doing is having diverse recruitment panels. So working with our colleagues who are being trained and who are part of that interview panel to ensure that when just about those conversations that happen after the interview, oh, I like this guy, I like that guy, it's about somebody going, yeah, well, I think this person performed well, and just having those diverse conversations and making sure that diverse voices are part of that that conversation. And this is something we've just recently tried out with our Director of Sustainability and Infrastructure. So we've had our first diverse interview panel. It went really well. We'll be having an update on how that's gone at our next GEMS group, which is next Wednesday. So we'll have the person who was part of that interview panel, and I think they're just going to look at formalising that in 2024 and training up a group of people to be able to do that role. So that's how we've approached it at the moment. So absolutely, it may evolve, it may grow, it may become something else as we go down that road, but that's been our starting point for that.
Thank you so much, Liz. Really appreciate the helpful advice. Well, we will stop the recording now. So please put your hand up if you want to ask a question in person. We would absolutely love to